Hello, my name is Dr. Padrta. I'm a fellowship-trained foot and ankle surgeon at Northwest Orthopaedic Specialists, and I specialize in foot and ankle surgery along with reconstructive surgery of the knee and general orthopedics. In this video, I will be discussing ankle sprains. Typically, a patient who comes to the office with an ankle sprain will have complaints of pain and swelling over the outside portion of their ankle joint. This is often a result of a twisting injury where the lateral ankle ligaments are stretched or partially torn. The most common cause of an ankle sprain is an inversion mechanism, where the foot rotates inward relative to the ankle. This can result in a stretching or partial tearing of the ankle ligaments. This often occurs in athletes on the basketball court or the soccer field, but it can also occur in the general population because of a fall or an awkward step. Ankle sprains are usually seen in the athletic patient population, secondary to the high demands placed on the ankle ligaments. Athletes who participate in sports that require cutting, pivoting, and twisting place a high demand on the lateral ankle ligaments. The pain you experience will depend on how far you stretched and tore your ligaments. Instability takes place when there is a complete tear of your ligament or a dislocation of your ankle. Patients will often report hearing or feeling a pop in their ankle, accompanied by pain and swelling on the outside of their ankle joint. This is sometimes accompanied by an inability to put weight on the ankle, which may indicate a higher severity sprain, or even in some cases an ankle fracture. Ankle sprains are diagnosed through a patient history and a physical examination. When you're seen in our office, we will evaluate you from a clinical perspective as well as a radiographic perspective. Oftentimes, radiographs are needed to ensure that there is no fracture or break in the bone. There are 3 different grades of ankle sprains. The first grade is a minimal sprain, which results in minimal tenderness and swelling in your ankle. This means you may have microscopic tearing of collagen fibers in your ankle and will need to do extra stretching to relieve the pain. The second grade of ankle sprain is moderate. This grade of ankle sprain results in moderate tenderness and swelling with a decreased range of motion and difficulty standing on your ankle. This means you have a complete tear of some, but not all, of the collagen fibers in your ankle. You will be given a splint and you will undergo physical therapy to help heal your ankle. Third grade is a severe sprain. If you've experienced a severe sprain, you will notice significant swelling and tenderness, and you will not be able to put any pressure on your ankle. A severe sprain causes a complete tear or rupture of your ankle ligaments. You will complete physical therapy and your ankle will be immobilized. Surgery may be needed in severe cases. Treatment for an ankle sprain typically includes RICE, which stands for rest, ice, compression, and elevation. The majority of ankle sprains can be treated in this manner, and most are resolved between a period of several days to several weeks, depending on the severity or grade of the sprain. Lateral ankle ligament reconstruction is a surgical procedure that is used to restore normal stability to the ankle. This will also fix your feeling in your ankle if it tends to give out and any associated pain. This is an outpatient surgery and usually includes the use of an arthroscope. During this procedure, we shorten and tighten the natural ligaments of the ankle and reattach them directly to the bone. In some cases, your own natural ligaments are not amenable to direct repair. In those cases, we have to use additional tissue to augment your normal ligaments. In those cases, we have to use a more complex reconstruction, which may include a tendon transfer or an allograft may be necessary. This can often be determined in the office preoperatively to give you a better idea of what to expect. Patients who have experienced an ankle sprain are usually able to return to activity anywhere from 2 weeks to 2 months following their injury. It's important to take time to rest the ankle and perform range of motion exercises in order to achieve a full and successful rehabilitation. To learn more about ankle sprains, please visit our website. Thank you for choosing Northwest Orthopaedic Specialists for your care.